does it mean to you to see all of these educators getting vaccinated today, and how many do you expect will show up?
So obviously this is a historic day in our community. Everyone's very emotional. You have a sense of hope and optimism that we haven't seen in the last year. We just huddled with our clinical team, the pharmacists, the nurses, and talked about that, just to appreciate the day. And how they are so excited to be of service to this community. They're amazing people just in their day jobs. And when you come out and see them and what they're doing today, it's just phenomenal. So we were expecting to do between 7,000 and 8,000 people over the course of 2 days, and broken in half equal parts between today and tomorrow.
How much vaccine is available as of right now to vaccinate all of these educators?
So there's enough vaccine available for every educator that wants to get vaccinated to get vaccinated. So I don't have a specific number, but if there are educators that want to be vaccinated, they can come out and they can get it done. And there's also an alternative date next Tuesday as well to get them done. There should be no reason why there's any teacher that wants to get vaccinated for them not to.
What challenges has the local health department faced as well as the hospital systems faced when it comes to getting this vaccine out to the people that want it?
Sure. So the biggest challenge that we have, right, is that this is the first pandemic in our generation that has really, come forward and presented these kinds of issues in terms of, its lethality, of how, contagious it is, those kinds of things. But with all those challenges in mind, the greatest thing that you see going on right here today is how we overcome those challenges. We have this partnership that's been formed and developed where we've come together, we've centralized our resources and focused them all at a specific moment in time to vaccinate as many people as we can here today.
Governor Mike DeWine, as of recent, lifted the state's curfew. So are you concerned that cases will rise again even with the vaccine out?
So obviously the governor, when he set up his protocols and to release that curfew, he went through a number of different algorithms to hopefully prevent that. I don't think anyone can determine, whether or not they're going to rise, they're ever going to flow. We don't know that. What we do know, though, is that the key to overcoming those issues is vaccinations. We know it's safe, we know it's effective. We look at our first responder community that Mercy's taken responsibility for vaccinating, and we know that once we have them vaccinated, the incidence of them becoming symptomatic has dropped precipitously. So it's really important. We want to beat this. We want to get back to normalcy. Come out and get vaccinated.
What trends have you noticed once the vaccine started getting rolled out? Have you seen cases decline, deaths decline? What have you been seeing?
So I think what we've seen across the entire state is that we've seen a general decline in the amount of new cases that we've seen. Specifically, what I'm familiar with is the first responders that, again, Mercy Health has taken responsibility for. So 6-7 weeks ago, we saw a very high rate of positivity. We saw a number of people that need to be tested because they were sick. That has dwindled to the point where we've actually cut the hours that we're testing first responders because there just isn't a need for it. And the people that do need to be tested, we're not seeing as high a positivity rate with them that we saw 5 or 6 weeks ago. Again, there's very clear evidence the vaccine works. It is safe, it is effective. It's really important for people to come out and get it done so that we can move on with our lives.
Even with the vaccine out and available, there's still hesitancy among the Black community about getting the vaccine. Why do you think that is, and how are you going to help persuade them make a decision about getting vaccinated?
So that is something that we're focused on every day. All providers out there recognize the challenge that we have. From a reasoning standpoint, there's historical issues for certain. We certainly understand that. But at the end of the day, we really need to focus on solutions. And the solutions is to work with existing infrastructure for folks that are comfortable in that community to come out and help support them. And that's what Mercy Health is committed to. We recognize that one of the biggest challenges, especially in the African American community, is people not getting vaccinated. We have got to do that. And we're working on partnerships right now, much to what you're seeing here, to go out and effectuate that.
For someone who has already been vaccinated, are there any side effects that come with the vaccine, and how severe are they?
Sure. So everyone's different. Everyone reacts differently to it. I have had very minimal side effects. I'm not aware of anyone that's had significant side effects, but everyone's different. People can experience everything. As you've heard, it's all over the news. Fever, aches, injection site soreness, those kinds of things. All things are manageable. But I guess the only context that I would provide is that nothing that I've heard is anything worse than actually having COVID-19, having that and having to be in a hospital on a ventilator.